Well, good evening, ladies and gentlemen and everyone. Welcome to this Wolper Wellbeing Forum on adult ADHD, and a special welcome if this is the very first time that you've joined us. My name is Julie McCrossin, and it's my pleasure to be your host this evening. This webinar is in fact hosted by Wolper Jewish Hospital, Friends of Wolper, and our partner for tonight's webinar is ADHD Australia. If you are new to us, Wolper Jewish Hospital is a leading private hospital in Wollara in eastern Sydney, and it provides medical, rehabilitation and palliative care to everyone in the community with a framework of Jewish culture and religious and dietary requirements. I'd like to begin this evening by acknowledging that we're coming to you from the land of the Gadigal people, and pay my respects to elders past, present and emerging. Very quick housekeeping as we just have a few more people joining us. I want to let you know that your questions this evening are most welcome. We have received a lot of questions in advance, but you are able through the chat function, if you just look down below and click, you are able to lodge questions, and they will be monitored by our question monitor. And that is Dr. Lena Safro, who's an experienced general practitioner. And I will come to her regularly during the evening, and she'll come onto the screen and bring some of your questions to us. Remember, we can't hear or see you, so questions are the only way that we can directly communicate with you. And I do want to say that all questions will be asked anonymously. We'll answer as many as we can, and our apologies in advance for those that we can't answer, but we will be sending all of you links to evidence-based websites where you can get more information. And remember, this webinar is being filmed and will shortly be up on the Wolper Jewish Hospital website, and it has quite a substantial additional audience after this evening. Well, as I say, a big welcome to you, and welcome also to the CEO of ADHD Australia, Melissa Webster, who's going to kick off remarks. Welcome, Melissa.
Thank you so much, Julie. And thank you so much for inviting me today. So today I come as the CEO for ADHD Australia. I also come as a person with ADHD, and I also come as a parent with a 14-year-old boy also with ADHD and other disabilities too. So ADHD Australia, we've been around since 2014. We're one of the leading national organisations in the ADHD community. And we are governed by an effective and dedicated board, and we are a 100% volunteer organisation that is fully committed to supporting individuals to live a better life for those individuals with ADHD, and to looking at focusing on removing barriers for those individuals with ADHD. We want to continue to look at improving resources and to be able to continue to improve services for individuals with ADHD, working in partnership with individuals with ADHD to be able to have a really active voice, and to look at how we can continue to drive the need for better services across the board, from children and people through to adulthood, to continue to be able to raise awareness for those individuals with ADHD, and to continue to implement positive support programs to be able to get great outcomes for individuals across workplace, health, education, justice for parents and carers. So from our perspective, it's really around how we can add difference and how we can partner with the ADHD community, and how we can partner with our partners that are trying to do some fantastic work in this space of ADHD, to look at how we can be heard and to how we can drive a positive change. Thank you, Julie.
Thank you so much. Thank you. And we will be sending a link to your website, which is full of comprehensive information to everyone who's registered for this evening. So actually, this is an opportunity to show deaf sign clapping. So thank you very much for your presentation.
Thank you so much. Thank you, everybody. Enjoy the sessions.
Thank you, Melissa. And if you've just joined us, this is all about ADHD, and your questions are welcome. I just want to check if our technical man could let us know, should I be suggesting they're through Q&A or through chat? I just wonder if you could just help me with that one, but they are coming in on Q&A at the moment. But look, just before I welcome our panel, we're going to do a quick live poll just so they can get a sense of you who are watching us tonight. So I'll read out the question. I'll give you 30 or 40 seconds to answer the question. and then we'll give you the answer in real time. And it has been clarified for me. If you do have questions or comments you wish tonight, please do it through the Q&A option. But I'll ask Nat to put up our first poll question, please. ADHD, do you or your child have attention deficit hyperactivity disorder, ADHD? And if you could tick me, child, both, neither. Thanks, Nat. We'll see our replies. So 20% have a diagnosis, 27% have their child with a diagnosis, 18% both, and 35% neither. Thank you. And our next question, please. How old were you when you were diagnosed with ADHD, if you do have a diagnosis? And I'll let you choose 29 years or under, 30 to 39, 40 to 49, 50 to 59, 60 years or over. Not applicable, obviously, if you weren't diagnosed. Thanks, Nat. So 13% 29 or under, 6 30 to 39, 11% 40 to 49, 8% 50 to 59, and 5% 60 years or over. That's amazing. 57% of people viewing tonight don't have a diagnosis. Our next question, please. What is your gender? Female, male, other, or prefer not to say? Complex question. I'll give you a little bit more time. That was a small joke. Thanks, Nat. Thank you. So nearly 80% of our viewers tonight are women, 21% male. Thank you so much to those gentlemen who've come along. Our next question, please. Symptoms. Which of these do you experience? And obviously you can tick as many as apply. Do you often have difficulty concentrating on what people are saying to you? Do you often leave your seat in meetings when you're expected to remain seated? Do you have difficulty unwinding and relaxing when you have time to yourself? Do you often find yourself finishing the sentences of people before they can finish themselves? Do you often put things off until the last minute? Do you often depend on others to keep your life in order and attend to details? So I'll just give you some moments there. Okay, Nat, I think we can get the flavour. So 64% often have difficulty concentrating on what people are saying. 21% do often leave their seat at meetings when they're expected to remain seated. 64% difficulty unwinding and relaxing. 70% find themselves finishing the sentences of people. And 78% often put things off until the last minute. Thank you so much for saying all this. We have 2 more to go. Our next question, please. How have these ADHD symptoms impacted your life? And obviously you can tick as many as you like. Negatively, I've learned strategies to manage them. I've learned to turn them into a positive. Thanks, Nat. 68% negatively, 64%. Oh, sorry, Nat, would you be able to pop that back up? 64% I've learned strategies to manage them. 31% I've learned to turn them into a positive. And our final question, please. Do you take medication for your ADHD? Okay. Uh, 67% no, 33% yes. Look, thank you so much. Well, it gives me great pleasure now, ladies and gentlemen, and everyone, to welcome our panel. And between now and just before 9 o'clock, I'll be interviewing our panel members and seeking their views. And I'll also be coming regularly to our GP, Dr. Lena Safro, and hearing some of the questions that you've been bringing to us. Now, I'll introduce everybody in detail as I bring them up, but we are welcoming Professor Michael Kohn, a paediatrician with a great deal of experience with people with ADHD, Dr. Peter Heffernan, a consultant psychiatrist, also with great experience, Vivian Dunstan, the founder and CEO of ADHD Support Australia, a different organisation with very much a focus on family support and information and education. And Vivian has a diagnosis herself. And welcome to Rody Bajo, who lives with adult ADHD and is also a coach and a mentor. So this is the deaf sign clapping welcome to you all. It's just great to see you. I'd like to come, if I may, first to Professor Michael Kohn, the paediatrician. Michael is a professor at the Sydney Medical School at Westmead, an academic director of the Centre for Research into Adolescent Health, an expert in ADHD, and a past chair of ADHD Australia. Look, Michael, can you begin by just giving us a sense of what ADHD is and how there's been a shift in the way that it's viewed, just to introduce it to people who may not be familiar with this information?
Hi, Julie, and thank you to all the Wolper team.
You're very quiet. I wonder if I could get some help. Have you got your microphone on?
Yes.
Are you able to help me, Nat?
Yes, well, he's not muted, so it must be.
You're not muted.
Yes.
Could you speak again now, Michael, please?
Lovely. Look, thank you. Julie, thank you very much for the introduction, and to the Wolper team for organising a fantastic meeting this evening. It's lovely to be with the panel, but that there's 180 guests online is just a phenomenal outcome. So thank you very much. ADHD, I think, can be summarised as cognitive inefficiency. So basically what we're saying is, if you have ADHD, then how your brain is solving problems isn't working as efficiently. There aren't skills developing as expected in childhood, or performances in various aspects of life occurring as an adult.
And how has there been a change in the understanding of what causes it or the nature of the condition?
Thanks again. That's a great question, because the answer is absolutely. And one of the real game changers the last 5 years has brought is understanding about the genetics, but also some of the other biological mechanisms that occur in people with ADHD that distinguishes them from people who do not have ADHD. So I guess the outcome of that is, the first thing is this rubric that I grew up with, that it was bad parenting, just being slack, bad behaviour, that's gone out the window completely. So we know that's got nothing to do with ADHD. And what we're seeing is that those people who are neurodiverse have a range of gene changes from birth, typically. And added to that, life experiences change the gene outcomes. And we can measure those ways now. They're mediators that are evolved through the immune system, the inflammatory system. So it's then through life, that interaction with your genetic endowment that confers whether you continue to develop cognitively and efficiently, or whether there's interruptions to that occur.
Now, I'm going to come back to you repeatedly tonight, but just to get a snapshot of your sense of the goal of treatment, because my understanding is that diet, stress reduction, exercise have a very crucial role to play, as well as some people using medication. Can you explain why those classic bits of health advice apply to ADHD, including
very much so, and it's a hand in glove with this current understanding. So if you modify your immune mediators. So if you change lifestyle to decrease the inflammatory mediators, the immune system, if you down-regulate, you will improve control of ADHD symptoms. And that's true right through the lifespan, but particularly in the adult lifespan, where not so much the genes are determining the ADHDness, but it's these changes to genes that occur through inflammation and the immune system.
Just before I come to Dr. Peter Heffernan, I know that you feel it's important to focus on strengths associated with ADHD as well as challenges. Why is that important? And can you give us a sense of some of the strengths?
That's right. And I mean, I'm very keen to pass over the baton here tonight, but it is really something that was my learning through engagement with ADHD Australia. So I can tell you how those people with ADHD score in various kinds of psychometric assessment, behavioural charting. But what I learned through my connection with the community and through the board of ADHD Australia is that it's not just a burden. There's ways in which having ADHDness is a gift, and it gives energy. It gives hyper focus. It gives the ability to get out on a stage or out on a sporting field or work as an entrepreneur. There are a range of ways that ADHD confers advantages, but also has its downside. And I think your questions already outline a little bit of that tonight.
And we will, but I just want to say, when we spoke before tonight, you said there's a sparkiness with ADHD. And I thought that's a very interesting word. What do you mean by sparkiness?
So, you know, I think there's that energy that comes with ADHD. There is that, people call it an impulsiveness. It's sort of giving it a negative aspect. But certainly being there, promoting yourself, sharing your thoughts, being part of a community, being aware of change. There's a range of ways there where that spark that you have with ADHD is conferring an advantage.
I can see the questions coming in. So let me come. Thank you so much, Professor Kohn. But I'll come now to Dr. Peter Heffernan, who's a consultant psychiatrist, extensive experience in assessment and care of adults with ADHD. He's a member of the UK Adult ADHD Network and a past chair of the College of Psychiatry's ADHD Network. So a big welcome to you, Peter. Now, you have sort of 4 words you like to use, don't you, to talk about ADHD. So tell us your 4 words and what just in a nutshell, what each of them means, why you think they're important.
Look, thanks for that introduction, Julie. And look, also to echo Michael's thanks to the Wolper organisation for bringing this vitally important public mental health issue to the forefront of our audience, to the forefront of our community. Just to take an exception to what Michael has to say before I answer that question, as a consultant psychiatrist, I see patients who are suffering. I see patients who are disabled. I see patients who don't come into my consulting room saying, whoopee, I'm a person with ADHD lived experience. Tell me how great it is to be ADHD. Quite the opposite. I see the disabled end of the ADHD spectrum time and time again. I see a transformation of that suffering, a transformation of that disability, and a move in the direction of a creative, constructive life that's worth living. Now, we know that ADHD is common. We know that it's very serious. We know that it's readily identifiable, and we know it's eminently treatable. We've suffered over the decades, from decades literally of medical, psychiatric neglect of this particular field, so that those with ADHD lived experience who end up in drug and alcohol addiction, their ADHD was overlooked. Individuals who ended up in the criminal justice system, in the prison system, their ADHD was never assessed for, was never recognised. Those who found themselves into landing in the gambling halls of the country, in the Gamblers Anonymous settings, getting counselling, that the ADHD is dismissed. Those with bipolar disorder diagnosis or borderline personality disorder or schizophrenia, time and time again, the ADHD was just missed as the other more overt matters attracted attention. And in the last 10, 15 years, there's been a growing awareness of really what we're facing, which is an epidemic of ADHD, not just in children, but in adults. 1 in 20 with the ADHD lived experience, often complicated by the ghastly complications in terms of self-image, self-esteem. There's nothing quite like a conventional education system, high school, primary school, university, to leave a person with ADHD lived experience feeling insignificant and a flop, a failure. So I don't see those that Michael is hoping to amplify tonight who see ADHD as a positive. I see patients desperate, for the help that they need.
Now, I'm going to come back to you, Peter, but I just want to briefly introduce our other 2 panel members, and then I'll take some questions. It's just I've noticed that Vivian Dunstan and Rody Bajo have both been nodding madly. So may I just firstly come to you, Rody Bajo, and I should introduce you as a young man who has been diagnosed with ADHD, and you work as a coach and a mentor with adults with ADHD. You've been nodding like mad, Rody. Rody, just tell me 1 or 2 things that have moved you because you think, golly, that's right, as you've been listening.
I think I agree with both Professor Michael and Dr. Peter. As an ADHD coach, I work with predominantly professionals and business owners who have been diagnosed within the past 5 years, and they have had ADHD throughout their lives. They've had those traits, those symptoms presenting over and over again, and largely due to the stigma and the misinformation about ADHD, that it is behavioral, it is an external thing, it's naughty boys that can't sit still in class. That stigma has prevailed, and it's forced people to, hide any misgivings they might have, any traits that might be viewed as a moral failing or as a judgment on them. And it's prevented them from looking under the hood to see it's actually not, a difficulty with paying bills, or it's not, challenge. They can't hold down a job, or they can't hold down a relationship, or they can't maintain friendships. It's in fact executive dysfunction, and in different ways, in similar ways, there are people that have struggled massively. They have fallen into addiction. They've, they are suffering. They're genuinely suffering, and I see both groups as being at the mercy of kind of the same challenge, which is, as a society, we have not understood ADHD. We have not known how to understand this specific neurotype, the specific brain wiring. And we've asked people to conform to a specific set of standards of how to do work, how to think about careers and holidays, and also a specific, morality as well, that, this is the way that you should be doing friendships. This is the way you should be doing, careers. This is the way you should be, doing hobbies or managing your money.
Rody, let me just come in, if I may, because I want to get to questions shortly because they're piling up. But you told me that getting diagnosed in your mid-30s was a life-changing experience because so many things suddenly made sense. Could you just give us a sense of what made sense? Why was that such a relief to get that diagnosis?
Good question. I suppose for me personally, I ran my own business for 10 years. I have, 3 young children. I have had a lot of change. Change has always been the constant for me. And so I've been very proactive in my life in looking at productivity tools, how to manage my time better, how to deal with anxiety that has presented over and over and over again in my life. And every time I've come up with a solution or a strategy, it's only just worked, it's only just covered it, but not quite. Or it works for a short period of time and then it stops working. And so it's been this constant rhythm throughout my life where, constantly, forgetting to pay bills, forgetting to take the bins out on bin night, dishes piling up because you just think, oh, I'll do it later, and then you never do. So having that ADHD diagnosis and then diving into the research and finding out how my brain is wired and understanding that actually my brain is wired differently. That, as an example, I have something called time blindness, which means I lack an internal perception of the passage of time. And when I understood that, it suddenly made sense why some of those strategies worked and some didn't, and what about them worked and didn't. And
lateness, a common pattern of lateness can be so difficult in relationships, can't it? People can feel disrespected.
Absolutely, yes.
And so, it seems like a small thing, but it's not a small thing.
It's not. In relationships, in a work setting, making sure you're on time for meetings, even appointments to doctors, dentist appointments every 6 months. So not having an internal perception of the passage of time simply means you have to work with your brain, not against it. So why do I have to remember when things are? So instead, if I externalize time in a visual way to, say, a week view calendar, then I can look at time as a physical thing. And then I can see when, how much time I have between meetings, or how much time I need to leave before I need to leave to an appointment. Whereas if I'm trying to do it in my head, then I think, oh yeah, no, I've got plenty of time. It's only a half-an-hour drive. And I forget that I, need to actually get in the car and take my things with me. And then obviously I forget something. So I go back in, get back into the car. Then I'm running late. There's some construction down the road. Then I get there and I don't factor in parking time. And, that's funny. And that happens to people. It's a common human experience from time to time. But for me, it's a constant. And that's,
yes, you've explained that to me, that it's and the others will hear it's a continuum, the diagnosis, but there's also diversity of intensity, but it's the frequency and the intensity of the dilemmas. I just want to introduce Vivian Dunstan to our audience, and then I promise the questions will begin. Vivian is the founder and CEO of ADHD Support Australia, and her daughter has a diagnosis, and so does she. Vivian, you've also been nodding a lot. I know that there'll be family members watching this evening, and you began because with your daughter's diagnosis you wanted to help families. So what's your key message to families who are watching tonight, who are listening and thinking and perhaps concerned?
Yeah, so I did begin back in 2013. My daughter, she's 26 now, but she got diagnosed actually relatively late, which is quite common for girls, or it was back then, maybe still is, I'm not sure. I started a local support group and quickly found, there was a massive need out there. There was nothing really happening back in those days. It's fortunately got a lot better now. But what would be my message is to, knowledge is power, arming yourself with the information, get as much information as you can. And, like everyone's been saying, ADHD is not just ADHD, it's very unique to everybody. As you've all said, there could be traumas, life experience, personality, strengths, weaknesses. You could have comorbid conditions. That was something I was sort of nodding about, really, because if you look at myself with the diagnosis, I don't have a comorbid learning difficulty, whereas my daughter does. So a lot of academic work is difficult for her. It's not so difficult for me. It's more of the time management and procrastination about starting for me than actually doing the actual work.
You told me that understanding leads to compassion, and I thought that was a very strong thing to say, not only for family but for work colleagues and friends as well. Is that why you've placed such an emphasis on education, running webinars and so on?
That's right, yes. I've been running them every month for the last 10 years, with a whole host of different experts coming on to talk about anything from medication to meditation to exercise, if we've talked about, to sleep and, you know, psychological things as well. But yeah, I think the more we know, the more we can do and the more we can help. And certainly with the parents I work with in the parenting courses that I do, parents understanding what their child is going through and being able to have that empathy for them is so important. So important to think they're not doing this because, you know, I actually love that Dr. Ross Green, kids do well if they can. You know, no kid wants to mess up and, you know, argue with their parents and do badly at school. They don't want to do that. So, you know, having that understanding that they're not doing that on purpose, why they're doing it, you know, what it looks like for individuals with the different comorbidities and so on, that's really important. And then you can have compassion. And also as an adult, having compassion for yourself as well, the more you understand. And I think as Rody said, you know, when you have that diagnosis, things do slot into place. It's like, oh, okay, so that's why I do that, you know. And yeah, time management for me is a big one, like always late everywhere I go. And people just know that now.
Thank you so much, Vivian. Now, I want to ask my panel, I'm going to go to questions, and I'll invite Dr. Lena Safro to join us on screen. And I just want to say, if we could go for reasonably concise answers and see if we can get through quite a lot of questions, because we have had an unusual number of questions. So I'll do my best to choose the best person. But if you're going to explode, if you don't get a chance to comment, just wave at me and I'll bring you in, because I don't want you to be frustrated either. But thank you, Lena. Could we have a question, please?
Thanks, Julie. There are certainly lots and lots of questions. So I'll start with the basics. Someone wants to know, how would I know if I have ADHD? What are the symptoms? And what type of testing is involved in diagnosing ADHD?
Look, thank you. And I'll come, if I may, to Dr. Peter Heffernan first, because of your work a lot with adults, and then I'll come to you, Michael, as well. So would you answer that question, please? You need to turn on your microphone, Peter.
Someone keeps turning it off for me. Look, thanks, Lena. Thanks, Julie. There's a massive amount of information out there in cyberspace. That the resources like the ADHD organisations that we're hearing about today have got websites where it's very straightforward to actually get a rough feel for whether one is likely to be ADHD lived experience or not. The next step is to identify an expert in the field and get a referral from a general practitioner to an expert in the field. Now, I'm often asked, how do you identify an expert in the field when it comes to ADHD in adulthood? And there are two guiding principles for me. Firstly, if a general practitioner is a member of the Royal Australian College of General Practitioners ADHD interest group, you're halfway there. So always ask the secretary, is she a member of this ADHD interest group in the College of GPs? If the answer is yes, continue with that initial appointment with the general practitioner. If you want to ask an even more sophisticated question of the secretary, you'll say, which general practitioner, which psychiatrist does that general practitioner link in with? And is that psychiatrist a member of the Australian ADHD Professionals Association? And if the answer is yes, you go for it. You'll know that you'll be linking in with a hub of experts. Now, the general practitioner is very likely to be able to give a good appraisal when they come from that ADHD interest group within the College of GPs. And the GPs know that they do have the backup of psychiatrists who have the credentialing and a really good approximation is, if the psychiatrist that the GP works with is a member of the Australian ADHD Professionals Association, you can rest assured that you're very likely to be in good hands. And look, at the end of the day, the clinical psychologists with ADHD assessment training, the general practitioners with ADHD assessment training, and the psychiatrists with the necessary assessment in ADHD, they are the ones to see for that adult population. The other side to it is, as I know Michael knows, if you're a parent with a child who's been diagnosed with ADHD by a developmental paediatrician, you must work on the assumption that you are a parent with ADHD lived experience. And if the paediatrician doesn't send you off for an assessment for ADHD, you actually get in contact with the GP and say, I need to be assessed for ADHD, because we really need every child with ADHD to be in the care, in the company of parents whose ADHD has been adequately addressed, so that they can get the best out of what parents have to provide.
Could I just say, because while I understand the significance of the answers you've given, you're giving general guidance of where to go to trustworthy professionals, but things like attention, focus, concentration, emotional regulation, and you also this question of a sense of meaning and purpose, they're the sort of things you're looking at, aren't you, when you're making your assessment? I think the audience want a sense of what, as a psychiatrist like you, actually looking at.
Yeah, so look, the art of medicine, the science of medicine goes back over 5,000 years. My ancestors back in Ayurvedic medicine in ancient India were thinking about pattern recognition. This is the pattern, here's the diagnosis, we give this particular pattern. And in medicine, in modern psychiatry, we're really looking for patterns. And there is a characteristic pattern of difficulties in the ADHD lived experience domain. So yes, attention, focus, organisation, emotional regulation, managing relationships, managing time, managing complexity. Behind those kind of surface kinds of issues, and my guess is that Rody and Vivian would both agree, that when a person with ADHD lived experience, when the activity holds a great deal of sense of meaning and purpose, ADHD people are there for day after day after day, applying themselves to that activity without any difficulty whatsoever. But the capacity to generate that sense of meaning and purpose for ADHD people is very fickle. What holds a sense of meaning and purpose this afternoon may be devoid of meaning tomorrow morning. What holds that sense of meaning and purpose next week may vanish like a mirage in a month's time. And so there's this characteristic pattern of swapping and changing, attention and focus, concentration on the video games that can go on for hours and hours and hours, attention and focus and concentration on getting the tax return prepared. It doesn't last a millisecond. The other aspect to it that Michael's also raised is, look, we've got all of these lifestyle factors that can be improved. The ADHD person, they know what they need to do, they just cannot do it. Sensible diet, sensible sleeping hours, exercise, they can't do it until they've got their ADHD addressed. Yeah.
Thank you, Peter. Michael Kohn, would you like to add something in relation to this question of diagnosis? If you need to turn on your mic, I'm sorry if I'd ask people not to turn it off and let people do it themselves. Thanks.
Lovely, thank you. Yes, I think what Peter's given is a very full answer. So if I can sort of hive off a little bit, I think having the symptoms doesn't mean that you need to get a diagnosis. And I absolutely take on board what Peter was saying earlier on. Those people at that severe end, those people where having those symptoms leads to impairment, they're definitely that group that needs that professional support for diagnosis and ongoing management. You can recognize those same traits in yourself. But again, not necessarily will you have a diagnosis that's helpful. For instance, I noticed that one of the, in the question and answer, someone's clearly pointed out that there's a large number of people identifying tonight with ADHD, but a relative minority of them actually having prescribed medication to assist with overcoming those symptoms. So it is a full spectrum. There is a very big downside at the severe end, but the majority of people on the spectrum aren't there. And so again, I think one needs to be aware, alert, but not alarmed in the context of having recognised the symptoms.
Look, thank you. And I just want to flag that my understanding is that Dr. Heffernan believes very much in a multidisciplinary team approach, just so that we do address that at some point. But I want to stay with audience questions at this time. Lena, another question, please, or group of questions, if there is a trend.
Oh, there's certainly lots of trends. So somebody wants to know, does ADHD look different between men and women?
Okay. Michael Kohn, would you have a go at that?
Yes, I did offer a little bit in the chat. So short answer is definitely yes, as most things do. On the genetic side, again, we see very much the ADHD genetic load having to be greater before in females there's the symptoms recognizable as ADHD. And there are some theoretical ways to actually understand that. I think that there's a range of ways that the being female and how you develop, how you communicate, it mitigates some of those ways in which you can become obviously symptomatic with ADHD. And exactly as Rody was saying earlier on, the girls in particular are good at hiding those symptoms. And again, typically why, especially in that inattentive group, they tend to present later.
Could I just ask, but each of you, if you could give a concise answer, please, why has there been such an increase in diagnoses for adult ADHD people? Just quickly from you, Professor Kohn, and then I'll come to Dr. Heffernan.
I think we've tuned in.
Could you just explain that a bit more?
I think that what it used to be was recognised quite simply. ADHD was a condition of childhood and you outgrew it. And we simply know that's not true.
So are you saying that a diagnosis once made is likely to extend through the lifespan?
Yes, and in fact, we now recognise that well established in the literature. That's correct.
Okay, thank you. And Peter Heffernan, if you could turn on your mic, what would you say to why more people are being diagnosed as they get older?
Oh, I've got no doubt that in our community, the activists who've been working to vigorously promote the recognition of ADHD in our community that previously has been denied, has previously been demonised and denigrated, going back 50, 40, 30 years ago by the anti-psychiatry movement, but also in more recent times, also denied, but by the silos of specialists in the various areas of adult psychiatry. So the schizophrenia professors, they diagnose schizophrenia. They don't look for ADHD, they don't see it. The professors who are experts in bipolar disorder, that they see bipolar disorder, they've always missed the ADHD. The addiction medicine experts, they see the addiction, they've never seen the ADHD. And then we've got this groundswell, this grassroots movement, the ADHD Australia, the ADHD Foundation of Australia, and the other grassroots movement have said, we are here, pay attention to us. We need help. We need community support. And I think it really is that groundswell of community that's making the difference.
Okay, thank you. Lena, another question, please.
Sure, this is from someone who was diagnosed with ADHD around the age of 40. My biggest struggle has been responding to people who react with, but you don't jump around, you're doing well socially, or saying things like, aren't we all a little bit ADHD? What do you answer to that?
Look, that is so interesting. I want to come to Vivian Dunstan. Let's give our people who are dealing in the grassroots a voice. Is there some merit to the view that we're all a little bit ADHD and that it's a question of intensity and frequency? What would you say?
Well, I think, the doctors will back me up in that, it can't just be sometimes. Sometimes I lose my keys, sometimes I forget things, sometimes I'm late. It's, something that's impacting your life negatively, something that's happening like on a daily basis, I would say. So yes, it can be a bit annoying when people say that, because yes, those things do happen to them, but you know, it then sort of trivializes the condition itself.
Yeah, I know when I spoke to you, said you quite often have people come and say to you, what's going to help me get a better life and be happy? And that's a frequent kind of message that you receive, which is obviously indicating some suffering, isn't it?
Yeah. So, and as I said, I sort of see those three components there of having a healthy life after a diagnosis, and those being the understanding, knowing more about the condition, the compassion, and this is understanding for yourself and other people in your life. So if other people in your life are also on board with that and understanding it, so whether that's a parent, a spouse, work colleagues, friends, and then you've got that compassion for yourself, they've got compassion for you and that understanding. And then, of course, you've got that support that you might be looking for as well. And, as we've said, everyone's different, and that support might look different for different people, whether, as you've said, that's medication, whether it's ADHD coaching, whether it's a social skills that you need, or, any manner of things.
Rody, when we spoke, I had a sense that you had masked a lot of what was happening inside you for fear of being thought less of, because there was a stigma. So that question made me think about that friend saying, oh, but you don't. But it may be that many people are not as being open and frank about what's happening inside them. Your comment on the audience question, please.
Yes, absolutely. I think, growing up with ADHD, you lose your keys, you forget to pay the bills, you miss dentist appointments because it's 6 months apart and time doesn't compute in our brains. We forget to pay our registration on our cars or put them in for a service. Everyone does that, we miss, we want to manage our times better, and we want to get on top of our tasks. So we Google it and we search for strategies. And so there's this sense that everyone kind of struggles with these things. But
so what's different about you?
So we don't really talk about the extent of how much that happens. That's one major factor, is we don't talk about the negatives. We don't, we try, especially if it's around, money and relationships, we tend to hide those things, those areas. The other thing that emerges is, people with ADHD live at a particular pace of life. We think at a particular pace and we communicate at a particular pace as well. And we have certain communication styles, and we tend to gravitate towards each other. So you'll see this in the playground. You see this throughout childhood. Children that jump around tend to, attract other kids that jump around. And so your friendship group largely is similar to you. So you look around, you think, oh, everyone's kind of similar. So there's that sense as well. I think the challenge is really that stigma, that misunderstanding of what is ADHD, and almost people seeing it as an excuse for that, morality, for the, bad judgments, for the mistakes, rather than an explanation of why things are happening in our life. And that's where those kinds of comments are coming from, with, oh, but you're fine. Oh, you can manage those things. It's not really that big of a deal. And that comes from a good place. Like they're trying to alleviate your concerns, not understanding that this, for many people who do get that diagnosis and start making positive changes, it isn't a concern. It's actually a positive step.
Look, thank you very much. And I can see that Michael Kohn might be answering questions madly on the screen, but keep an ear on us as well, if you would, Michael. But Lena, another question, please.
There are several questions which I might put all together.
Thank you.
And I think one of our doctors would be able to answer this. Are there any specific medical conditions associated with ADHD? And the few things that have come up in the questions are bipolar disorder, hormonal fluctuations in women, including menopause, and connective tissue disorders.
Thank you. Can I come to you first, Michael, coming as perhaps predominantly from the childhood perspective as a pediatrician, and then answer it from an adult perspective. So it's really this question of comorbidities, co-conditions.
Yeah, so again, it's a really nice question to sort of segue into that new knowledge about how the internal environment affects development of the brain and ADHD particularly as an outcome. So there's no question that if you're a mum and you're pregnant and you get gestational diabetes, you are more likely to have a child with ADHD. There's no doubt that if you're a mum and you've got an autoimmune condition, any condition that upregulates the inflammatory system or the immune system is a predisposition, increases the likelihood of ADHD occurring in your developing child. So there's a great concern about the number of women that were pregnant with COVID, SARS-2 over the last few years, that what we're going to see is a further increase in those neurodiverse people, in particular in those young people. A higher proportion will go on to be diagnosed with ADHD. Similarly, those same processes affect brain growth, brain development, brain changes. So they accelerate the degenerative changes that happen rather than the generation changes when you're an adult. And there's a lovely question in the chat I was just tapping on about allergic conditions. So similarly, what we do recognize is if you have those, you are predisposed to having ADHD develop, and you might be on the track. It's a threshold, it's a continuum, but those conditions do increase the likelihood of ADHD.
Just ask you, and then I will come to you, Dr. Heffernan, the same question. I'm just thinking about, you know, I'm getting a sense of increasing diagnoses, but also, if we're talking about something like connection to COVID, the capacity for even more increases. So what does this tell us about the capacity of our health system? Now, Michael, stay with me, darling. I'm going to have to take you off your computer. I want you to stay. Michael, would you turn on your mic? I'm asking you another question. And if you would leave it to Lena to do the work with the audience, if you wouldn't mind. But
Sure.
what I'm asking you now is, I just want to cut to the chase of this question of severity. So when is medication a good idea? What are you looking for to go there? And should there be access to the NDIS? And should it be still a restriction that that specialists are required to get certain medications? These are all three hot topics. Can you just go to each of them from your perspective, and then I'll come to Dr. Heffernan.
Just as well I wasn't typing. 3 in a row is very hard, Julie.
Well, I'll do them one at a time. I mean, the first question is, it really goes to this question of the capacity of our health system to cope with this increasing range of diagnoses combined with comorbidities. And so I'm interested in the question of access to medications and when they're important, and should it be confined to consultants to be able to give that access?
I think what treatment you have, medication or otherwise, is a contract between yourself and your treating doctor. And I think ADHD is no exception. I think medications for ADHD, as has been mentioned in the chat by Peter, yeah, they're very effective. And so they need to be on the table. But so too, there are other options for people who have ADHD being diagnosed. And again, really, we've heard beautifully from Vivian, from Rody, that there are definitely good ways to manage ADHD. And it's a contract, it's an agreement between the treating doctor and the person. So what medications you can have are stimulants in particular for ADHD.
But aren't there only certain medications that GPs are not allowed to prescribe?
So look, that's a moving feast, and it also changes what state you're in, even in Australia. Okay. So there are conditions upon which GPs are already able to prescribe S8 drugs, stimulant medications. But what we do need is, I think, a much more rational system of being able to provide effective treatment, medications included, that meets the need for people with ADHD that does not exist at the moment. And that may mean having doctors prescribe. It may mean having other people in the community being able to assist with medications along this line. Peter, over to you.
No, I'm staying with you for a moment, because it has been raised with me that for people from lower socioeconomic groups, the payment of specialists to get access to certain medications, and I'm quoting Vivian Dunstan here, that is something that is raised with organisations. And so I guess I'm seeking your views on, professional views. General practitioners are, I think, are going to be getting additional special training in ADHD. They have released media releases for greater diagnostic capacity and prescription capacity. I'm just interested in where you sit on that.
Yeah, well, my personal view is that I would like the diagnostic process to remain with the specialist consultants. The ongoing treatment does not need to reside with them. And that would be, again, an initial entree, GPs getting experience into the ways in which medications can be used safely, and possibly to be built from there. ADHD Australia, I know, and again, I'm hoping you're going to segue to Mel and allow that broader perspective of views that we can bring in from the community on this subject. Yes, the community are definitely wanting access, and so public training, being able to go to a public hospital, not just because you've got a gout, but because you've got ADHD, is definitely an aspiration I have.
Okay, look, thank you. What I might do is come to Peter Heffernan, and then I will come to you, Melissa, and get your views. I'll in one moment. Your thoughts there, Peter Heffernan, please.
Julie, the reality of it is that the question that you're tapping into there really is drawing attention to a public health mess. It's a mess. Now, there are some who would say we can resolve the mess by having every GP prescribing stimulant medication for ADHD. But the evidence is, from the studies that have been done over many years, that if you have medical staff who don't have the necessary training, who aren't embedded in a specialist hub with the ADHD coaches, with the clinical psychologists, with the occupational therapists, if you have this one man or one woman band going on, the remission rates for ADHD are appalling. It's experts that get solid remission rates when they are working as a part of a multidisciplinary team. And multidisciplinary team has been around in medicine forever. Diabetes, asthma, hypertension, renal disease, it's all about multidisciplinary team working as a team. We need those teams in the public mental health system. Currently, it's banished. ADHD is denied in the public mental health systems right across the country. It's an absolute scandal.
Peter, can you explain that? Just what do you mean it's denied?
I haven't come across one patient in 35 years in psychiatry that was assessed for ADHD in a public mental health service. Not one in 35 years. Not one patient assessed for ADHD, not one patient where ADHD treatment has been implemented. It's an absolute scandal. So when it comes to those in our community, the less fortunate, the less well off, we must have a public mental health service in every state and territory that has the necessary expertise to manage ADHD in all of its forms, in its various guises. That's what we need. I'm delighted to have that growing recognition of ADHD amongst a small group of GPs who are interested in, who are passionate about doing that training, working collaboratively with developmental paediatricians like Sally Poulton and Michael Kohn. They're in New South Wales. I'm delighted to hear that there are GPs like Carmel O'Toole and Shelley Gray here in Melbourne who are passionate about spreading the word and getting the education through to GPs. It's certainly a significant start, but we need a concerted government community effort to clean up this appalling mess, because people are suffering, people are dying, families are suffering, families are losing cherished loved ones because of this profound social community neglect of the ADHD lived experience. I'm not necessarily talking about those who are high functioning people who have features of ADHD, but bear in mind that in psychiatry, the definition of a psychiatric case is serious impairment. When we're hearing about people who aren't impaired, in a psychiatrist's perspective, they do not have a diagnosis of ADHD. It's those with serious impairment, and that's 1 in 20 in our community. It's a huge number that are needing attention.
Look, thank you so much. And Melissa Webster and Nat, if you could highlight Melissa, what are you, if you would like to comment on this question of access for people from lower socioeconomic groups and your thoughts there, please.
Yeah, I think both Michael and Peter have a huge amount of knowledge and input into this space. What I would say is definitely, from my perspective, there isn't enough individuals currently receiving the right supports, the right, I'd say, diagnosis, access to diagnosis, access to, some individuals are being diagnosed inaccurately because of lack of information that individuals have, and then later on in life, ADHD is being picked up. That comment to specialists, I believe, is absolutely, 100% right. There is not enough individuals that are doctors that specialise in this area. What I would say is the individuals from kind of that, low socio-economical background, individuals that sometimes have not necessarily got the means to be able to identify of when to actually access services. They're not able to access them from a financial perspective. They're not necessarily access them because of an educational perspective, knowing that there's some differences, knowing the challenges. And sometimes what I would say is that what we see and we hear is people then end up then, particularly in younger life, kind of going through youth and then in adulthood, take the wrong paths because they haven't been diagnosed, end up in the criminal justice system, end up with drug and alcohol addictions and other, and have significant challenges later on in life. So I feel that we know from what the community is communicating to us and from what we're told that it is an absolute huge gap. There's a lot of work that needs to be done in that space, and the impact to individuals is significant if people haven't got the right supports or service access available to them.
Look, thank you so much. Vivian Dunstan, Melissa, who we've just heard from, is from ADHD Australia. Vivian Dunstan is with an organisation called ADHD Support Australia, with a sort of predominant but not exclusive family focus. A quick comment from yourselves, anything to add there or that you'd like to say?
Yeah, and I did bring that up with you, Julie, before, because I get daily emails from people saying, like, what do? I can't get into a psychiatrist because there's not enough, and also I can't afford to pay for the assessment. So, a lot of the time, what can I do? But, I do sort of say that, perhaps while you're waiting, because we think that the gold standard is a multimodal approach, obviously, you're waiting to get a diagnosis and perhaps medication, but if you're waiting for that, you can also, you've got the symptoms, right? So you might as well try and look for sort of supports and strategies that can help with that. Start getting the information on board, get that up front while you're waiting. So by the time you get there, you're able to be like, oh, well, I already know all this about it. And then if you do have it and you get your medication, fine. If they say no, you don't, well, you still got some strategies in place to manage any symptoms of whatever that you've got.
Look, thank you. Again, there's great emphasis on the empowerment associated with information and understanding. Let me come again. I've got lots of questions, but I'm inclined, because of the number from the audience, to stick with the audience. So, Dr. Safro-Lena, if I could come to you with another question, please.
Sure. Again, sort of accumulating a few questions into one. A few people want to know if the diagnosis of ADHD in itself is a risk factor for dementia later on in life and for things like substance abuse.
Okay. Again, could I have a brief comment from each of you? I'll start with Michael Kohn, if I may.
Yes, I think so. I believe it is. So I think that certainly that gene pool that we were talking about that's been identified in neurodiversity disability, including ADHD, is the same genes. They overlap with a range of psychiatric conditions such as bipolar disorder and schizophrenia. So they are definitely ways in which the brain degenerates in terms of its function. And so I do think that one needs to be cautious in saying that, because it's not necessarily something that, yes, in theory, we see these changes in the brain. Therefore, if you've got ADHD, your ADHD is going to lead to your brain degenerating. I don't think that connection in a one-to-one works, but as a group overall, the causes of ADHD are associated with those changes and increased degeneration in the brain.
And so does that mean even more importance on exercise, on diet, on doing interesting things with your brain, you know, having intellectual interests at whatever type? That sort of general advice for good cognitive health is particularly important if you've got an ADHD diagnosis?
Yes, it's that kind of the dictum: be happy and stay healthy, use it, don't lose it.
Okay.
Julie, sorry to interrupt. The reality of it is that ADHD people know what they need to do, but without treatment, they just cannot do it. They know they need to lose weight, they can't do it. They know they need to stop smoking, they can't do it. They know they need to avoid recreational drugs, drinking too much, they just cannot do it. They cannot exercise, some can, most can't. So yes, look, I understand that the motherhood statements in terms of healthy lifestyle, but without effective treatment, there is this horrible trajectory. ADHD that's undiagnosed in childhood, slipping into recreational drug use by about the age of 15, and then into the drug dealer's hands until they develop all kinds of horrible complications, you know, from the recreational drugs in combination with the ADHD, psychosis, schizophrenia, bipolar disorder.
When
ADHD,
you say treatment, what are you meaning, Peter, exactly? That you must be in a multidisciplinary team with a supervising psychiatrist? Is that what you're meaning?
So our children must be routinely appraised in childhood and teenage years for features of ADHD lived experience syndrome evident frequently in the schools. You can see it in the school reports that we read. Would do better if only she applied herself. Would do better if only she paid attention. Would do better if she wasn't such a chatterbox or wasn't such a daydreamer. These are the teenagers that ought to be referred to Michael Kohn and his colleagues, so that I never see these patients who accrue these horrible comorbidities 10, 15, 20, 30 years down the track. The morbid obesity, the hypertension, the diabetes, the multi-infarct dementia from the smoking, the alcohol dementia, all of those horrible conditions that end up at the end of life, because there is that predisposition to that inability to lead that healthy lifestyle that leads to the dementia, that leads to the substance abuse, that leads to the train wrecks. And I'm talking about those who are seriously impaired that were evident in those teenage years, as Michael knows only too well.
Look, thanks, Peter. I guess I feel the power in what you're saying. Let me come to you, Rody Bajo. I mean, that's a pretty powerful description of the at-risk dangers. How do you, as someone with that diagnosis, how do you react to that message? Because you describe yourself as a mentor. You're clearly working with other people who've had a diagnosis. And it's a hard thing to hear, I suppose. I do come from a predisposition of seeking to engender hope.
Absolutely, and I love that, and I welcome that. I think I don't disagree with Dr. Peter. Both Michael and Peter earlier mentioned that it is, there's a range of presentation and severity of the different traits and symptoms. And, in some of the things that he just mentioned, I do, sense that, and I do relate to that. People with ADHD can't go to the gym. People with ADHD can't, stop smoking. They fall into drugs. That is the extreme case of what I what could happen to me, if I didn't have certain privileges in my life, or luck, or the luck of genetics as well. So there's that severity. Now, I think the thing for me that I suppose the thread that I see through them is, again, coming back to understanding the brain and why those things are happening. So Dr. Peter earlier mentioned that that sense of meaning and purpose and can make us focus on something intently for days, whereas paying a bill doesn't. And it's the same mechanism. It is a dopamine dysregulation in the brain. And so the question I always come back to that gives people pause is, why do stimulant medications, which are meant to stimulate people, calm ADHD brains? And that's really the big question, because for us, our brains are constantly looking for stimulation. And so that's why we are prone to addictions. That's why we are, we tend to focus and hyper-focus on certain things. That's why we can be so passionate about this amazing new hobby that we've discovered for 3 days, and we spend hundreds of dollars, thousands of dollars on a new horse riding equipment, and never want to see a horse again after that, because the saying goes, the dopamine has passed, right? It is no longer a stimulating activity for us. And so
the doctors to just quickly answer that question, because I think that is an interesting question. Professor Kohn, could you answer the question? Why do stimulants calm people down?
So it really is at the core. What a fascinating question. I think the new information turns that concept on its head. So just because dopamine fixes a symptom doesn't mean it's at the root of the problem. And that's the new learning. So cognitive inefficiency with ADHD means that you're not getting that frontal lobe exercised. You're not getting it activated to then coordinate and make an efficient response to a particular challenge. When you take the stimulant, that upregulates the frontal lobe in ways that the development of the brain is not working efficiently to do. So you can overcome the symptoms, and there's nothing wrong with the brain. It's just how it wires and fires is not working efficiently, ADHD. So that's why stimulants work, and inverted commas calm you. Well, they allow you to do more easily what you want to do, but it's not at the core of treating what we understand ADHD to be.
Yeah. What is at the core of treating it then?
So when we look at the genes, when we look at the impact that these immune and inflammatory modulators are having, they're actually not attacking the neurons. They're attacking the glial cells, these supporter cells that do branching, pruning, cleaning up, replenishing. So they're the servants of the neurons that are actually being attacked in neurodevelopmental conditions.
Peter, your quick comments, if you could be concise, because I'd love to do a couple more questions before we close.
So when I was a child, we had these wonderful Easter eggs that the Easter Bunny delivered to our home on Easter Sunday morning. It was a wonderful fairy tale, but it was a fairy tale. We've got a number of fairy tales that are floating around in the field of ADHD that are wonderful fairy tales that are useful, but because the alternative is to be able to say honestly and openly, I don't know how these medicines work. We know they do work. We've got study after study. I've got patient after patient where the demonstration is very clearly they do work, but we don't know how they work. If people want to use the fairy tale of Santa Claus or the Easter Bunny, that's all right by me. If they want to use the dopamine deficiency theory, the fairy tale, that's fine by me. But it's much more challenging to say, come back in 20 years' time, and we might have some genuinely scientifically based understanding of how these approaches, whether it's ADHD coaching or medication or mindfulness training or other forms of mentoring, we might know how walking through the forest improves ADHD, but at the moment, your guess is as good as mine.
Oh, look, I love that kind of frankness. Can we have another question, Lena Safra?
Oh, someone wants to know if you're trying to diagnose ADHD and you do an MRI scan of the brain. Can you see anything different than those pictures?
So Peter, an answer from you and then a comment from Michael, please.
So going back 6 years ago, I was at a conference in London where a particularly gifted neuropsychiatrist, Katia Rubia, was demonstrating that the sequence of functional MRIs that were taken following the trajectory, the response to treatment with a medicine called atomoxetine, and it was just mind-boggling. You could actually see on the functional MRIs the change in the structure, the change in the functioning of these brain cells in the front part of the brain, the dorsolateral prefrontal cortex, heading in the direction of normalizing, looking and functioning like normal brain cells. And here was the clear example that we actually have the very clear evidence that these medicines do change the functioning of key parts of the brain in lockstep with an improvement in the severity of the ADHD syndrome. So yes, look, if my patients have got a spare, $10,000 sitting around that's lazy, we could send them to London and get that series of fMRI scans that would demonstrate the anomalies. And there are so many studies that are demonstrating that ADHD brains on the fMRIs and the other brain imaging techniques, they are different to the so-called neurotypical brain.
Okay, thank you. Michael, would you like to comment?
Just a quick one. Yeah, I think my earliest experience of being able to see that for myself was the work of Philip Shaw, again, now about 20 years ago. And if you just Google Philip Shaw, ADHD, what he's got is a summary of his research looking at MRI scans that were taken of young people growing up, young people who had ADHD growing up, and young people who had ADHD and took medication growing up. And so, yes, you can definitely see there's a maturational lag. There's a developmental lag in those with ADHD that comes closer to the non-ADHD group, for those with ADHD that took medication. But you can also see through the MRI, not at the individual level, but at this group level, that there's a thinning of the cortex. Again, consistent with this problem with branching and pruning that we now see, but we did see evidence of it with imaging. So in a range of ways, as Peter said, and these earlier size measurements we can do as well as functional measurements, we can definitely use the MRI to see ADHD.
Fascinating. Lena, can you have another question ready? But I just want to see, does Vivian, Rody, or Melissa have a question? You three live this much more intensely. Is there any question you would like to ask the clinicians that we have with us tonight? You don't need to, but I just thought I'd offer the option. No? Or a comment you'd like to make on anything that's been said? Melissa, did you want to say something?
Look, I think from my perspective, I have the absolute privilege of being able to reach out to Michael when I need a question answered. So I don't for that very reason, and he provides me a wealth of knowledge. So no, not from my perspective.
No worries, not at all. I just thank you. Vivian, would you like to say something?
Yeah, I just wanted to add into that conversation we were having, and I do like to have a little bit more optimism. As I've said, with the information, what Michael said about the inflammation of the brain and the glial cells. I like to sort of talk about sleep and optimizing sleep, because that's when you're asleep, your lymphatic system is working and cleaning out the brain. Don't know if that's the best way to put it, but yeah, I also sort of think that I definitely know what it's like to know what to do and not be able to do it. I think I've got the book. Actually, there is a book called that. I know what to do, so why don't I do it? And yeah, I've had trouble, losing weight, keeping up an exercise routine. Doesn't mean I can't, and I don't. And my daughter also, she's actually unmedicated and does struggle, but she eats healthy. She doesn't do drugs. She doesn't drink at all. She exercises, she goes to Pilates every day, she surfs, so I'm saying that, you can, and I like to put it out there of how that can help, you know, having that good sleep, getting the exercise, you know, improving your diet, all of those things. You know, I think we need to put it out there that those things can help. And, you know, with as Rody does and the education I do with that coaching to help people work out, well, how am I going to do it? How am I going to keep that habit going?
Thank you very much. Lena, let's have another question, please.
If I sorry, if I just make a quick comment.
Oh, I beg your pardon, Rody. Yeah,
no, it's all right. Yeah, I just I want to thank Professor Michael and Dr. Peter. It's been really good to kind of hear your perspectives and a very level-handed and extremely knowledgeable approach. And you know, the advancement of that research is so important. For me personally, I survived for 34 years. And I had relative privilege and I did well and I did okay. I'm an immigrant to Australia from the Middle East. I'm Kurdish originally. I came here when I was 15. And I've had a lot of challenges throughout my life that I couldn't understand or make sense of until I got diagnosed with ADHD. And I can honestly say, you know, I got diagnosed almost 3 years ago now. I would not be where I am today, and I may not even be here today if it wasn't for that diagnosis. So even with, you know, on the outside, everything was going well, right? It was ticking the boxes. You know, life was fine. It was good. There was nothing wrong. I wasn't on the severe end of ADHD, but there were challenges that were presenting over and over and over again that I could not understand or could not deal with. And now I have 3 beautiful little children and they've started going to school, and I had parent-teacher interviews last night and it was not what I wanted to hear. They're one, but I was prepared for it. I understood, you know, I have completely changed the layout of my house to accommodate my children and to create an environment for them that will, you know, they can thrive with their creative little energetic brains. And I think that's the work that I would, you know, that I see both of you doing, and Vivian and Melissa and Lena, and I feel privileged to be a part of that as well, because it does impact people's lives, and more importantly, our children's lives, the, you know, schooling that they go into, the future world that they will eventually walk into. You know, this is the work that is extremely important and changes people's lives.
Can I just say one little add-on to that?
I'll come straight in, but can we just clap, Rody? This is deaf sign clapping, ladies and gentlemen, because that was just so well said, sir. Thank you so much. Melissa, yes.
No, just really quickly, just to add on from that, Rody, I think it's really important to really recognise that, you know, ongoing support, resources, early diagnosis, continue to listen to the differences that community have. What I would say is that just because somebody presents as actually being exceptionally capable on the outside, for example, somebody that has a hyper-focus, and, you know, talk about myself, my hyper-focus is work. In my workspace, I'm exceptionally successful. But it doesn't mean that I don't forget my children's appointments. I have relationship difficulties, all of these things that come on with my ADHD as an individual. And it doesn't mean that it makes it very easy for my child also. So what I would say is that when people sometimes look at people with ADHD and they see a person that is looking to be very successful, they absolutely are. And the talents that we have are outstanding, but it doesn't take away those disabilities. It doesn't take away the challenges that you have. And the support is absolutely needed to be able to ensure the community gets the right supports to succeed. And in a nice way, Peter, doesn't end up in your arms.
Listen, we're so close to finishing. Thank you, Melissa. But Lena, is there either a question or a comment you'd like to make as a practicing general practitioner about something you're taking away from this evening?
Well, I was just about to slip in a question, pretending that someone else had asked it, and many people did in different ways. I think it's worth pointing out to the audience that we cannot discuss specific brands of medication, and there are lots of questions about that. But in a general sense, people want to know, how do you choose the right medication, and what is the effectiveness, and what are the common side effects?
Now, gentlemen, I always finish on time, so I'm going to ask Peter a very brief comment. I know it's a big question, but a brief comment, and then I will come also to Michael from the pediatric or children's point of view. Dr. Heffernan, please.
Yes, Lena, every branch of medicine has their stock standard list, the stock standard algorithm, the list of 4, 6, 8, 10, 12 medicines. The ones that at the top of the list are the ones that are most reliably effective, the ones with the least likelihood to cause side effects. And every clinician, every specialist, every general practitioner just works systematically down through that standard list that is well known to every specialist. So that's the first question. How do you choose? You start at the top of the list and you work systematically down until you find the medicine that's effective. Second question, common side effects. The vast majority of my patients don't have side effects for more than one day, because my rule of thumb is if a patient's getting a side effect from a medicine I'm recommending and supervising, then that's the wrong medicine for that patient. And we move our way down through that list until we find the side effect-free dose of the right medicine or medicine combination that does the job in achieving remission. Yeah. Common side effects are common when patients are taking too high a dose of the medicine, but my patients, they don't take too much of the medicine that I'm supervising for more than one day. If they're getting a side effect, we wind back the dose, the side effects resolve. If that doesn't achieve remission, we move on to the next medicine.
Thank you so much, Peter. And Michael Kohn, please. Oh, your microphone's off, sir.
I'm in a more fortunate position, I think, in that treating a child with ADHD means that you've just got to treat the higher centers, the ability to be able to sit in the classroom and do what they're told. Much simpler than what an adult has to be treated to be able to do. And for me, in treating that condition, stimulant medications are very accessible and very effective. So I think it is a simpler equation, but there's an upside and a downside for everything, and it's got to be a contract between the patient and the doctor.
Ladies and gentlemen, thank you so much. It's been a compelling conversation, and I hope you all feel you've had a chance to say the essential things. Our apologies to those whose questions we couldn't answer, but we will be sending you evidence-based websites where you can pursue more information. But I want to thank Professor Michael Kohn, Dr. Peter Heffernan, Vivian Dunstan, where's my friend, Rody Bajo, and also, of course, Melissa Webster. And thank you so much to all of you. If you could give some deaf sign clapping to you all. And I just want to let you know, thank you, ladies and gentlemen. I want to thank you all for coming and for being with us and staying with us. You will be sent a survey asking you to give us anonymous feedback. They really do read it, and they really do change things as a result of it. So please complete it. This has been recorded, and it will be on the Wolper Wellbeing website, so Wolper Jewish Hospital. It usually takes a few days, but by mid next week, it'll be there. Our next webinar is on Monday, the 11th of September